been a while since I've reacted to a Try Guys video, but here goes again. This one's called I Got Hair Restoration Surgery. And as a double board certified hair restoration surgeon, I'm gonna give you my thoughts.
And before you go commenting about my hair loss,
make sure to check out this video telling you exactly how I lost my hair. Let's jump into it.
We want everything to look great in the front, but also in the back.
Dude, it's crazy looking back here.
What is that supposed to mean?
Remember, for any hair transplant, you've got the recipient area and you've got the donor area. Donor area is usually from the back of the head. Recipient area is where the grafts are going. Sometimes it's to the frontal scalp, but remember, sometimes the recipient area is the crown, and that could be very close to the donor zone. And you have to treat both with tremendous care in order to get the best possible hair transplant results.
I am getting a hairline refresher.
We'll follow your exact hair pattern and make these new hairs blend well with them.
I think society today thinks that you can only get the hair refresher if you've had significant loss. That's not the case. You can actually get a hair refresher without losing any of your hair. You look good.
I like how they call it a hair refresher. That's a cool way to spin it. Yeah, basically a transplant can be done when you've lost hair, but where the hair loss has now stabilized. That's one way to do it. Another way is, yeah, sometimes people just have a hairline that they find to be not ideal for their optimal aesthetics, and they want the hairline brought down a little bit. They want the corners brought in. You know, there's different things that can be done to, let's say, optimize the hairline. But yeah, most of the time when we do hair transplant surgery, it's because people have actually lost some of their hair, and they're coming in because they want it to look closer to how it used to look.
The people here in the office, when we told them that you were doing this, most people were like, wait, what? Matt has such great hair.
I mean, that's what everyone said too when I told them, but I feel like I'm just good at hiding it. The hair that I do have is really thick. It's really just like around the temples is where I need help.
So let me give you my thoughts here, because I don't agree with this type of design. So we'll see what the surgeons actually do, but at least how in this edit they've marked out where he wants his hairline. This is not an optimal aesthetic look, especially when people get a little bit older. So meaning when you're 14 or 15, yes, sometimes there's this kind of downward trajectory and almost like this curvature towards the temple. But as we age, there's always some degree of lift or recession that occurs here. And one common error that I see, and also requests that I often get from patients where I have to educate them on how that might not be the best design, is that they want this downward curvature towards their temple from the widow's peak or the center of the hairline. The best way to do this is to keep some degree of recession, which might be counterintuitive because people say, oh, but I feel like there's too much skin here and I want to close it down. So if you're looking to drop the frontotemporal corner and you find that hey, there's too much skin still here, the right adjustment is to actually bring the temple in more. So medialize the temple, and that will close down the corner more, instead of creating this downward trajectory towards the temple. So again, something that I commonly have to talk to my patients about, to explain to them why this is a less than optimal appearance, because if you do it this way, the hairline will look too straight and a bit artificial when you actually bring your hairline up. So when the hair is down over the face, people might not tell, but if you ever combed it back, you could see that, hey, something looks a bit off, even to someone with an untrained eye. So anyway, we'll see what they actually do, but these dashed lines here are not the, in my opinion, most ideal way to draw out a hairline.
Most of the men in my family are bald, so I knew growing up that one day I would need to do something to help with my hairline. I guess it was back in my 20s, right after college. I woke up one morning and there's just so much hair on my pillow. So I went to the doctor and started on finasteride, which is kind of the first thing that everyone starts.
So exactly, so 20s to 30s is when most guys see the most aggressive hair loss. So for some guys, it's even, earlier than that in their late teenage years, but that's uncommon, right? So usually 25 to 35 with is when exactly what he's saying, you know, guys will see more hair on their pillow, they'll see more hair falling out in the shower, they'll see more obvious recession occurring, and sometimes by the time they notice, they've lost a lot of hair. That's not what happens with everyone's hair, right? Like some people will maintain their hair into their 30s and 40s, and then there'll be a slow reduction. Those patients will be less likely to arrive at like a Norwood 5, 6, 7 pattern compared to those who start losing their hair earlier in life. But that is the common time to lose hair. And then yes, the first line will usually be for guys to get on finasteride, or in some more aggressive cases, even dutasteride, and that's for prevention. And again, we've got feelconfident.com, where a lot of people in the States now get their finasteride because it arrives directly to their door. It's cheaper than a lot of places, including places like CVS or, you know, some of the other online vendors. So definitely check out feelconfident.com if you're looking to potentially get started on preventative hair loss medication.
I think there is, you know, extra pressures, especially in the gay community, to look good. And so that extra pressure on me forced me to be really preventative about hair loss. And that's why I did go to the doctor right away to start finasteride. And that's why I'm here now before my hairline gets worse.
So ideally, finasteride will prevent further hair loss. So the concept is that you're stabilizing your hair so you don't continue to see the hairline receding. So I don't think hair transplant surgery should be viewed as, oh my God, I have to do this now, or else the hairline is just going to go push back too much. Because, you know, when we design hairlines, we do it in such a way that we hope that the hair behind where we transplanted doesn't continue to go away, because then you have got this moving target and you're continuing to chase it back, and it's very difficult to have enough grafts to sustain that type of continued, you know, transplantation surgery, because eventually you run out of grafts from the back of the head and you may not reach the density that you're hoping for in these recipient areas. So again, the medical therapy should be viewed as a way to stabilize your hair. And then if you're looking for some hairline contour changes or additional density, then consider transplant surgery.
I did go back and rewatch all of your videos because I do not want to end up like a swollen potato face, okay? I do not want to be a swollen potato for a week like you were.
I remember reacting to this video back in the day, so if you want to know what my thoughts were on that case, definitely check it out. So we use a steroid in our tumescent mixture. We also give a one-time dose of steroid right before the surgery. That helps mitigate some of the swelling that can drop down the face in the first week after any kind of frontal scalp work. But remember, that's not foolproof, and so some people do swell up, you know, to varying degrees, and that's just kind of a part of the transplant recovery process. And if you want to see one of my patients go through the full recovery, and he documented his week by week, month by month recovery, make sure to check out this video here.
Before, the procedures were much larger procedures for more advanced hair loss. Over the last 5-10 years even, the techniques have gotten so minimally invasive with such low impact, low downtime, that the threshold to do something is much less than it used to be. You know, the average age in the country is around 32, 33 years old.
Oh, wow.
You know, for hair transplants, yeah.
A lot younger.
It used to be a lot older.
I think part of the reason for younger and younger patients getting this surgery is not because the technology has improved, but because it's more available. You know, the surgery is more widespread. There's also more options and different price ranges for people. So, you know, some folks travel to certain countries where they can get it done cheaper. That wasn't always available to people, right? To let's say, you know, younger guys, right? So it's the fact that it's more widely available and there's just more chatter about it, right? We have social media now. We never had it before. So you get online and you start seeing, you know, information about transplant surgery and, you know, all people's experiences with it. That's something new. And that's, I think, part of the reason why younger and younger guys are getting this surgery done. And also because we have things like finasteride to prevent further loss, younger patients are now becoming candidates for something like this. So I don't think it's necessarily because the surgery itself has improved. I think it's for the reasons I just mentioned. Of course, the surgery has gone through some changes, but even back in the day, I mean, smaller procedures were very common. You know, they may have been done with a strip excision, but they were still smaller procedures. procedures. If anything, the strips initially were much smaller than they ended up being. 600 grafts, 700 grafts in one session, right? So they were smaller surgeries. So I don't completely agree with what he's saying here. But, you know, yes, surgery in general has improved, but it is still surgery. It might be less invasive, but it still carries risk. And as you know, we have a video on risks and complications of hair transplant surgery. So if you're interested in that, please make sure to check it out.
I mean, my biggest concern actually is just to not blow up like Zach. I really don't want to be. I really don't want to be a potato face for a week.
Again, this is it's just not even a complication of the procedure, but part of the recovery process. So I think you have to accept that if you're going to go and get a transplant at the frontal scalp.
What else do we have to do today to prep for tomorrow?
We'll be doing your pre-procedure haircut.
Well, you can either do a full shave on the side or on the back, and that's usually necessary for the bigger surgeries. But with him, since they were smart enough to actually grow out the hair, we can create a window procedure where we lift this up here, shave throughout this area right here, and then use the hairs in this area, then cover it right back down.
Yeah,
so this will join with this, and it won't be obvious that he had a transplant.
Well, if the hair blows in the wind or it gets wet, it'll still be obvious. But yeah, I mean, there are ways to make the harvest less obvious. There's also a no-shave approach, right? So sometimes we'll do a one-by-one extraction without shaving at all. So we just trim the hair that we're about to punch out and remove, and we do that randomly throughout the donor space. We'll usually do that for up to maybe 1,500, 1,600 grafts in a day, because that's a more labor-intensive process than shaving and then extracting with FUE. So yeah, there's a no-shave option, at least that we do offer in the practice for the donor area for, again, certain cases. And yeah, sometimes you can just shave the window as they're describing here. And other times it just makes more sense, honestly, aesthetically, to just shave a bit more broadly throughout the donor area, and even sometimes to shave through, so you're not left with this little kind of stump of hair as you recover.
You know when guys lose all their hair, they still have the horseshoe in the back?
Right.
This is called DHT resistant hair. Never thins. And we put them to the front or the crown, wherever we're putting them, they'll maintain their DHT resistance. They'll never thin.
Wow.
Well, the DHT zone can thin somewhat over time. You know, you never know how small someone's horseshoe is going to get when they're younger, especially if they're not on medication. So that's something to consider, because for FUE surgery, we harvest from a very broad space to reduce the impact of the harvest on that space, where we don't want it to show too much with the depletion of hair and the scarring, right? So we spread out the harvest broadly, but as you do that, some of where you spread into might actually become DHT sensitive, meaning susceptible to hair loss. So that's some of the nuances of FUE surgery that, you know, people don't always talk about, but I think it's important to bring that up, because that is sometimes not completely accurate that the horseshoe won't thin, because it can.
Men don't really start to address hair concerns until probably like 40 to 60% of their hair is gone.
Exactly. It takes about 50% of the hair in an area to be gone or to thin considerably enough for you to start to notice that, hey, the hair seems thinner. So sometimes by the time you notice it, it can be a little bit too late for restoring it back to what it once was. But there's almost always something that can be done to improve the situation.
This is something like Voldemort would have. You know, how?
So yeah, so we do our own shaving here in my clinic. So we don't have anyone bring their hairdresser or barber into the clinic for the shaving. Sometimes people do for the design of the hairline, and we're totally cool with that. That's totally fine. But as far as shaving, we just do our own shave, and then you can always go a week later and get a fade so that it looks even more normal. Because it's not like the first week you're going to be, you know, going to work or going to a lot of social gatherings. So pretty much give it a week, and then you can clean up the donor area anyway, and then do a fade there. So that's what we prefer, because when people are coming in for the actual transplant and I'm ready to mark an area, I like to see the hair really grown out. I don't want to see a very tight fade, and sometimes for harvesting we'll keep the hair a little bit longer or a little bit shorter. So it's better that we decide that rather than the patient bring the hair down so short, and then it becomes difficult to actually harvest hair. And also, even if we're shaving the whole head for surgery, I still strongly prefer, if not require, patients to come in with at least a few weeks of growth, even for the patients who are used to buzzing it down. give me some hair to work with so I can see how it naturally grows and all of the densities in a more long format type of configuration, so I can properly design the recipient area and also design where we're going to be harvesting from. All those elements in my mind are a little bit easier to do when the hair is longer, and then for the actual doing of the surgery, it is easier to do it with a shaved type of approach rather than having a lot of long hair in our way. Though when that's a strong request from patients, we can deal with that as well.
Are you ready to see this?
I can't see. Ah! It looks like I laid in the bed too long.
So the issue with keeping the window so tight is that depending on how many grafts they're looking to get, if you pack too many holes, right, extraction holes, into too small of an area, that area is going to appear potentially a bit over harvested, right? So you need to be able to spread out over a larger space so that you minimize the impact of that harvest. So again, it depends on the size of the procedure. The window that they have maybe is okay for 1,000 grafts, and if that's all they're getting, then it should be fine. But if you're trying to get 2,000 grafts, it's a little bit too tight of a window. So we'll see what they do here.
But is it actually going to cover it?
Well, should we see?
Put down the drapes, David.
I'm glad they're celebrating this this early win here with the coverage of this donor space. But the thing is, the true win is that for like the rest of your life, you have a less obvious type of look, right? So again, that is more important than just being able to cover a small space for right after surgery, because you want to be able to minimize the scarring and minimize the hair loss over the larger space. That really is the ultimate win, because that's what you're going to be living with for the rest of your life. You know, we'll see how they manage that here.
You can send your loved one messages from the back.
So the upper border of where they've shaved is right up against where the crown would be, which is fine. But again, if he has crown thinning that occurs, it will impact that zone in part, because when you look at someone with a horseshoe in the back, oftentimes it doesn't necessarily reach that height, right? So that's something to keep in mind. And then the base of where they've completed their shaving is definitely within a DHT resistant zone, but that zone is going to surely extend even lower than that. So being able to, again, work into a larger space to spread out the harvest is really the ultimate goal. And they're working fairly tight. I mean, that's a small rectangle, and they're not even really extending ear to ear. Again, you don't want to take too much hair from any one zone, because it's going to start to look much thinner there. And your scarring is going to be worse because the scars will be closer together. And we'll see if they use the artist robot, which leaves scars of about 1.3 millimeters, well, now those scars are going to be very close together.
All right.
So they did the shaving the day before, which is interesting. It can definitely be combined on the day of surgery. You know, a lot of patients travel in to see us and from other states, other countries, so they don't necessarily want to spend any more days than they have to for their travels and for their time, you know, in New York, let's say. So some patients make a little vacation out of it, but others prefer to just come in for a full day's work and then do their thing. So if you're asking them to come in the day before, you know, again, it works for some people, might not work for everyone.
You ready?
I'm ready. Let's
Hey,
do
good
it.
to see you.
Yes.
All right. As we discussed, really, this is kind of the thing that we want to resolve for you, right?
Yes.
When people have that little widow's peak, what it is actually sort of like a cutout. What I mean by is like it goes down and then it goes up and it goes down. It's almost as if this was cut out. Yeah. So this little sliver. Yeah. So if you draw a straight line like that.
Too straight.
Exactly. But for you, it's like you get that little cutout almost, and that's what creates that peak. But you have that shape, so we want to preserve that. You turn sideways here. Yeah, this is the area here. You know, it's going to drop down these sides from you know, up here, to about, you know, here and here.
So it's good. He's trying not to go too straight for the hairline, which is definitely a good general approach. If he wanted to make the forehead even smaller, then the move here would be to move the temple in further, closer to the middle of the face. So we'll see if they do that, but it seems like he's trying to maybe avoid the temple and just work into the frontotemporal corner, which is absolutely fine as well.
The deviations and the feathering are what give you like a natural look, and so we do it throughout the entire line.
Like, what does that mean?
We do this pattern here, and then we also add little like satellite hairs on the borders, so it's a gradient, or else you'd have this harsh line, which we don't want.
Yeah, I mean, building in irregularity is super important, both micro-regularity and macro-regularity. So I think that's what he's describing here. They are going to be working to reinforce his widow's peak, which again, some patients like and some patients don't want, right? Some patients are actually looking to smooth out the widow's peak so it's not so prominent. But maybe in his case, he's actually requested that they keep the widow's peak. And that's really what they're doing here because they're emphasizing the widow's peak with their design.
So this gets you high, it helps with the pain, but it doesn't last. Like 2 minutes after you're done sucking it down, you're back to normal.
How are you feeling?
Amazing.
You're there. Thank you.
Yeah, our approach to minimizing discomfort for the actual injections of lidocaine is to use a vibrational device, or honestly just talking to the patients to distract them, using a small syringe, using low volumes of the actual anesthetic, not injecting too quickly, and making sure that the anesthetic is not too cold. I mean, these are all the things that can help minimize pain and discomfort. But, you know, even with this Pronox on board, you're still going to feel some of the sharper sensations when the needles go in. I mean, that's just what it's going to be. It's pretty brief and it doesn't last long. So that's a good thing.
Now I know why you said it was the best part of the whole time.
So for that space that they've marked out there, I'm going to guess that, you know, to get a good density going surgically, they're probably going to need anywhere from like 1,000 up to maybe 1,400 to 1,600 grafts, depending on how far back they've marked out, which was more challenging for me to see there. But that is most likely what the numbers are going to be. And the question is, did that zone that they shaved down in the donor area, did it accommodate for that number of grafts? And, you know, I think that's a debatable question, but we'll have to see how close each of the little extraction holes end up being.
So this will keep you numb for about 3 or 4 hours. And as you need it, we touch it up throughout the day so you stay comfortable. And if you need a break, please let me know. You're doing amazing.
This right here, this is like intentional swelling.
Part of this is the numbing.
Okay.
And then there's also a little bit of a steroid in there to prevent inflammation in the future.
And that's also what we use. We use a Kenalog 10 in our mix, and maybe they're doing something similar here.
But when we do make our sites, it goes in deep enough that if this wasn't there, we wouldn't have much space to actually make the hole.
And Matt said he does want to swell afterwards.
Oh, he does?
Yeah, he wants.
Oh, let me just take out all that steroid.
This was me.
Oh, whoa. Oh, that is a different person. You're a different person right there.
And then once it's numb, then we'll be making the recipient sites. It's basically the new hair pores. So you should just be feeling like a little bit of pressure there. How's it feeling?
I don't feel anything. I don't feel anything.
So we also these days start with the site making as the first main part of the day. But before I do that, I do like to take a small sampling of the donor area hair. So we do a couple of harvests, right? Maybe 4 or 5 grafts. And then we take those and we test them against the site size that we're going to use, because I feel like most of the time we have a pretty good sense of the thickness of the hair, but everyone's caliber is a little bit different. So it's better in my mind to do that small test before I start making, you know, thousands of sites potentially in a certain size. And we're testing for the largest of the sizes, because I'll always go smaller to be able to get tighter so we can build up our density. But those smaller sites will be for smaller units of grafts, right? So instead of putting a 3 or 4 hair graft into a small hole, we'll be able to fit a 1 hair graft or a 2 hair graft, right? But we need to know the largest size of the site in order to not create a site size that's too small for the largest grafts from that individual. So before we do site making, I'll take a small sampling of grafts from the donor area, and then we make our sites. and then we do the harvest, and then we do the implantation. And I'll always save some grafts for the very end to basically go in and fill in between to be able to get the density up even more.
It's going to determine the angles and directions of the hairs. So then when we get the hairs, which is the next step, then they will slide right into those.
When I did this, I used that robot right there, which we're not using today. How come?
The robot's good for like medium-sized cases.
Yeah.
For a smaller case or for a much larger case where we have to go into more angles, the manual tends to be a bit better.
Yeah, to be honest with you, the Artist robot is truly, in my opinion, a marketing gimmick. I do not think that it is superior to any of the devices that are commonly used at high-level clinics. Many places will buy the Artist robot and then realize later that, hey, this is not improving my efficiency, it's not improving the scarring for the patient. If anything, it's potentially causing worse scars, and they'll stop using it and they'll look to resell it, and then they realize no one wants to buy it and they're kind of stuck with it. So that is what the robot, seems to be today. Hopefully, there's going to be enough innovation in the future where robotics can definitely help us, in surgery. This is a very kind of long, labor-intensive procedure. So I welcome robotics and AI to improve the process, but in my opinion, we're just not quite there yet. So the handheld motorized devices for harvesting, in our case, we use the De Vroy system from Belgium. Those seem to be the best at yielding the highest quality of grafts and also minimizing scarring in the donor area.
Do the little stabby holes gross you out?
Kinda. Kinda. Blood doesn't really get me. It's kind of crazy because I feel like dandruff gets me icky.
Dandruff gets you more than blood?
Yeah.
The brick wall in the background is interesting. I think that's a cool look. My walls are currently like a plastic PVC that they're like extra cleanable and washable because, this is surgery. So sometimes you'll get some blood that stains the wall, for example. And if you can clean it super easily, that's a good thing. I feel like brick, could hold on to some byproducts. But again, if they have a way to disinfect the bricks extremely well, then I'm sure it's fine. But that's something to consider because, again, at the end of the day, this is surgery. And everyone other than the patient in the clinical room has to wear a mask in my OR. That is part of trying to maintain the best possible hygiene that we can. Again, hair transplant surgery is not required to be a fully sterile surgery compared to some other surgeries where the risk of infection is higher. So there have been studies looking at plain gloves versus sterile gloves for hair transplants and not seeing much of an infection difference, right? The risk of getting an infection because the infection rate is already so low. But that being said, you really want to optimize for cleanliness and near sterility as much as possible.
Glad you're comfortable because this is the point where we hand you the tool and you start making some holes.
Yeah, Matt, so very exciting.
Did you know that?
They're going to let me and Dave both get in there.
Oh my God.
You did it, Matt. Step 1 complete.
Congrats.
Wow. How many steps do we have?
There's 3 steps.
So we'll see if they give us the count, the graft count. So far, I haven't heard that spoken yet.
Just get up. How does it look? Louis fashion.
You forgot about the back of your head.
They give you a little.
Oh, I need my lunch lady. They had to punch holes in my head. Didn't feel anything. Very relaxing. You can definitely hear when he's like punching in your scalp a little bit, but otherwise pretty easy.
And the site making is truly the design work. That's the most important artistic step because that will dictate exactly the directions and angles, as that doctor said, at the recipient area. And not only that, but it's also the overall pattern and the degree of density and irregularity. All of that is set with sites. So it's extremely important to get that step right. And it looks like they've now completed that step.
And we're going to go ahead and numb the back of your head. Think of it as acupuncture.
You see, so similar to how we do the recipient area numbing, they're also using this vibrational device that helps reduce the brain's perception of pain. But I wonder if they're actually also using the Pronox system. I can see the tubing, but I'm not sure if he's grabbing hold of it and actually using it with being head down. I'm not sure, but it's not something that people generally need. Usually just the vibration or tapping the skin or again just careful injection is sufficient to keep people very comfortable for the numbing of the donor area.
Puncture, but for your head.
Scalp puncture.
If you need a break, just let us know anytime.
Well, that's nice. You put a blanket on them.
A nice little blankie.
And then afterwards, we'll be using this really cool tool to harvest each hair. It's kind of like a drill, like a hollow drill.
These are graft extractors. So as LaRon is punching the grafts, I use these to extract the grafts out of the back of his scalp.
After we take them out, we have multiple people in another room looking at each follicle under a microscope to make sure they're perfect. Because we only want the ones with the roots attached. We want them to be strong hair follicles so that when we put them in, they actually grow.
150 more, Matt. You got this.
So they still haven't said what the total count is, but seems like they're getting another 150. Yeah, it's important to, I think, check the grafts under the microscope. Sometimes you might have a follicle that's partially transected, so it's partially cut through. But even those sometimes will regrow when they're transplanted. But when we want to get single hair grafts, for example, for the hairline, we have to trim the grafts and we need to divide them under the microscope so we have enough of those single hair grafts. And in those cases, we don't want to have, you know, a quarter or half of an additional follicle that might regrow, because then the hairline can look a little bit too heavy, too pluggy, right? So we want those true single hair grafts, and they don't exist naturally in the back of the head at a high frequency. So that's why we create them under the microscopes, and I'm sure they are doing the same thing here.
How do you use hair as expression?
Hair is an expression because it's an extension of you. It tells kind of a story about what's going on in your life. So like if you woke up late and you didn't have time to do your hair, like people are gonna notice, they'll be able to see that. If you're not taking care of yourself, you know, that's reflected in your hair. It's really an extension of your health. So in that form of expression, I think it really shows how much you love yourself by how much you take care of yourself.
What does that say about me? No, as you guys know, I have an autoimmune type of hair loss. And, you know, I think initially when I lost my hair, it was pretty difficult to stomach, and it was kind of cathartic to be on here on YouTube talking about hair loss, talking about the different kinds of hair loss, educating people, getting confronted with some of the ridicule online, you know, but then you learn to deal with it. And, you know, I've kind of accepted it as my my new look after a number of years of being like this. And yeah, I mean, I still feel like I'm the same person. And I still think there are ways to show that you can take care of yourself without, you know, just having hair on your head. So yeah, but, you know, obviously for many of my patients, hair is really important. And I work really hard on trying to get them to keep as much of it as possible and to give them the best possible hair that we can give them, whether surgically or non-surgically. But I think you can have a strong identity with or without hair.
So we finished harvesting everything we needed. We did over 1,500.
1,500?
Yeah, so they said about 1,500, maybe just over 1,500 grafts, which I think is very reasonable for the recipient area from what I saw with the markings, especially because his neighboring hair is so thick and dense, right? You need to at least attempt to reach a similar kind of density with an initial surgery. Now, with any hair transplant, anytime you work into a more bare space, there's always the potential of wanting a little bit more density as a secondary kind of touch-up procedure, no matter where you go for surgery. But as far as that donor area, for 1,500 grafts or more, I probably would have liked to see a little bit of a broader space marked out and shaved down. But, you know, maybe they were able to manage it really well. You know, it depends on the punch size. There's a couple of different elements here. And maybe they'll show it and maybe they won't, because it could be a little bit graphic for YouTube. But I'm sure they dealt with it, you know, super well. This is, you know, a well-established clinic. But you guys have to understand that, like, the broader you work, right, the more spread out those little holes will be. So it'll be less obvious that work was done. I mean, that's the logic here.
We're going to just clean him up and he'll probably have lunch.
I look so official with this, guys. I'm one of you.
You're hired.
Thank you. Do I look beautiful now?
I'm hired as emotional support. Like, you know, in here.
What emotional support?
I've been here this.
You've been MISSING. Feeling fine. It's been an easy day. I'm ready for round 3.
Go get some lunch.
Did someone order a tossed salad?
Yeah, this is a pretty standard time for lunch break, which is great. I just want to avoid very spicy foods during this break, because then that'll lead to more bleeding potentially. And this is also the time that we draw blood and we do PRP for patients, right? We find that that brings down the inflammation in the scalp for recovery. It also helps reduce shock loss of the surrounding hair, the native hairs that you were transplanting next to, right? those original hairs that were there. So reducing that shock loss risk is very beneficial with PRP, and some patients come back for post-op PRP. We usually can resume it at 3 months after surgery, and then we can do it again at 6 months, 9 months, and that really helps support the recovery process.
All right. Wow, this is gonna look good. No running away now. We already did 2/3 of it. We just
I know, right?
If you feel anything else, let them know. We can always have more, okay?
Okay, got it.
All right. See you in a little bit.
And you literally just shove it in. That's all it takes. That's so crazy. Place it in.
Yeah.
So some people have transitioned to implanter pens, or you may have heard of it as the DHI method, direct hair implantation. We still continue to use this type of pre-made sites and forceps implantation as they're doing in this clinic. You know, there's pros and cons to both methods, and honestly, to this day, I continue to go back and forth about, I've tried the implanter pens, I've tried different versions of them. When you have an experienced team who's very comfortable with forceps implantation, it actually gives you a lot of versatility. And I still think it's an excellent way of doing hair transplant surgery. I think it's nice to start with recipient site making, as they did here, because especially for these finesse hairline cases, it's a way to know like what you can fit into the space safely, instead of doing a little bit more guesswork and starting with the harvest and then realizing you don't have enough grafts or you have too many grafts to place in. Because when you do implanter pens, especially sharp implantation, it's basically a two-step process, right? You first get the grafts, and then the grafts get loaded into implanter pens, and then those get injected essentially into the scalp. What I've found in trying these implanter pens is that they're often not sharp enough for my liking, right? So I have to push really hard into the scalp, which just, I don't like the feel of it in my hands. Now, there is a company out there where people say it has the sharpest implanter pen, so we're going to try that next, and maybe I'll like those more. But just as we're in the process of trying to invent a new type of harvesting device to optimize that process, so too one day I hope to create a device for the implantation side of things where it will just be better in the way that it feels, at least in my hands, and then hopefully it'll translate to other people as well. I do like the concept of bringing a three-step process, right? This is a three-step process, similar to how I do it in my clinic, where you have the site making, the harvest, and then the implantation. But with implanter pens, you can potentially turn it into a two-step process, right? Where you harvest and then you load into the implanter pens and you just inject them into the scalp. So that takes it from a three-step process to a two-step process. But again, there's pros and cons of both methods. And I think implanter pens have a little bit of a ways to go before they get to the point where everyone's just doing it that way and they're highly efficient. And we'll see when that transition occurs. I do think that eventually most people will be doing implanter pens, and then one day maybe there'll be a more automated system that allows for a quicker harvest, a quicker implantation with implanter pens, but hopefully keeping the same degree of quality that we can get with this more tried and true standard method.
How deep does it go in?
Like a couple millimeters.
It literally is like planting a succulent.
Yeah.
So in terms of how deep they're going in, so an average hair follicle is about 5 to 6 millimeters in length. And so you are placing it pretty much all the way in, except for a little bit of epidermis showing on the surface to allow for the best possible healing. But that is kind of how they're placed.
Matt, I know that you came in here pretty fearless, but for people who are maybe afraid of this procedure, like how are you feeling now that you're at the 2/3 mark?
It's not as stressful as you think it would be. As soon as you're numb, you're kind of unaware of what's going on. Like you can hardly feel any pressure. Is it weird watching it happen to someone else?
Yeah, it's definitely weird to watch.
I think it's important for people to see that you don't have to look bald to get this done, even though it is, in comparison to other things, a pretty minor procedure. It takes one day, and within a week, you know, you're pretty much fully recovered?
You're not really fully recovered at a week. The skin is going to continue to be pink. The crust will still be there at a week. The hair will first fall out before it starts to regrow, right? The transplanted hair, you could have some shock loss in the area as well, where the surrounding hair can look a bit thinner for months. And then to see your final result will take at least about a year. So it's not a week for the full recovery, but the worst of it is usually, you know, done at a week, right? In terms of swelling and that initial kind of dry blood type of look. Yeah, for that, you know, give it about a week, but then there's still the rest of the recovery. And we have another video about post-op care and recovery from a transplant, especially the instructions that we give patients on, you know, what they can and cannot do post-op. So if you want to check that one out, we're going to link to it or throw it up on the screen. And I wanted to highlight here also that, you know, it takes a village to do this kind of work. So you saw the head surgeon here, you saw his PA, you saw like there was a clinical manager, and then there were at least 2 technicians who were under the microscopes, and then they're probably the same ones who are doing the implantation into the pre-made sites. And so it really does take a village to make these surgeries work. So sometimes people don't realize that when they sign up for surgery. They think it's just like, you're just going to get the surgeon and that's it. You'll always get a team that goes along with the surgeon, right? That's very important. It's not a one-man job to do this type of work. Also, it takes time, right? So I'm not sure exactly when they started and when they're going to finish, but probably it'll be at least an 8-hour day. And, you know, you're talking about, you know, 5-6 people over the course of an entire day. So it is a labor-intensive process for sure.
Put the blood back into your body. Thank you for finding BSG hairlines.
Hairlines.
Yeah, hairlines. We're about to go here. The exits are here.
Hairlines.
Dude, it's crazy looking back here.
What is that supposed to mean?
Don't scare him.
So here's the donor area, and from what I can tell, they have nice spacing throughout the area. So I wonder if they had to expand that initial zone that was trimmed down by the hairdresser. I think maybe they went a little bit broader to be able to spread out that harvest. But from what I can tell, it's a nice distribution of actual, you know, small holes and scars. And the scars look appropriate size, and so it looks like they've done this process very well for the harvest.
But they're already closing.
Yeah, that's a wrap.
Oh my god, it looks so weird. It honestly doesn't even look like
anything.
But we tried to feather it out so it looks very natural, and it goes well beyond your hairline. It goes towards the back, what we drew out earlier.
Right. Wow.
So we'll see if this gives him the density that he's happy with. You know, sometimes when the neighboring hair is this strong, he might come back for a small touch-up procedure, but this might also give him enough to work with where he's quite happy with it. So time will tell. I hope you enjoyed this reaction video. Make sure to sign up to our newsletter at feelconfident.com. This way you get the latest information about hair restoration, plastic surgery, and you get to find out when our new products drop. See you soon.